Good morning and welcome to the APA Colorado Town Hall on Healthy Communities. This is Sheila Booth, the Chapter Administrator. I want to thank our sponsor, Baseline Engineering, and I also want to thank Dr. Cog for partnering with us on this series. The ground rules are, if you want to have any questions for our panelists, be sure and type them into the questions box, and we will try to address them throughout the event. If not, we will address them at the Q&A at the end, or possibly send them out to our panelists for them to address after the event is over. Some quick announcements. Our website is apacolorado.org. We do have some information on there available for you. We also have the recordings of our past town halls if you're interested in listening to them. For those APA members who are going to MPC 20, you know that it is canceled. It does have a 3-day online virtual conference starting next week, April 29th through May 1st. It's low cost, $125. You can watch the webinars online live, or you can watch them on demand over the next year. Our AICP, the May exam, has been rescheduled to summer 2020. Your grace period has been extended to May 29th. We do have a lot of free CMs being offered online now to kind of fill in the gaps while you're at home so you can get those CMs done. And for now, the Colorado Planning Conference that is planned for September 30th through October 2nd is still on. We're moving forward. We don't know what it's really going to look like in the end, but we're going to keep moving forward and hope that we get to meet in person this fall. So with that, I'm going to throw it over to our moderators, Braden Nicholson and Elizabeth Young-Wynn, the Healthy Communities Committee co-chairs.
Good morning, everyone. Thank you for joining us, and thank you to Sheila and the APA Colorado Board for providing us with this opportunity, and thank you to our committee members for their support. My name is Braden Nicholson, and I'm a planner with Bohannon Houston.
Hi, everyone. I'm Liz Young-Winnie. I'm a built environment planner at Larimer County Department of Health and Environment.
Thanks, Liz. And we are the co-chairs for the APA Colorado Healthy Communities Committee, and we both have a background in public health and planning, working at the intersection of the two professions to improve population health. And Liz will just be assisting throughout as needed. Next slide, please. So our committee is made up of public health and planning professionals advocating for health across our Colorado communities. We meet virtually every 6 weeks. And if you're interested in learning more, please contact us at healthy@apacolorado.org. Next slide, please. So to advance our committee's mission, we're here today hosting this town hall on healthy communities. And we wanted to first provide a brief overview on the connection between health and planning and mention our role as planners to supporting healthy communities. So from the public health perspective, we promote positive health outcomes by focusing on what we call the social determinants of health, which are the conditions in which people are born, live, learn, work, play, worship, and age that affect a range of health outcomes. And as planners, we influence these determinants through the decisions we make surrounding land use, urban design, and transportation, which then have an impact on health factors such as access to physical activity and affordable housing. So what this means for planners is that we have this unique opportunity and role to create environments that promote good health for all and collaborate across sectors, and in particular with public health professionals to improve community health. Next slide, please. So moving on to today's agenda, Sheila kind of already went over the welcome, set some ground rules, and provided announcements. In a second here, I'll introduce the speakers, and then each speaker will have a few minutes to individually speak. Then we'll move on to the Q&A, and that will be based on comments that you sent via the chat box and in your registration. So our presenters today we're very excited to have them here. Also, they bring a wealth of knowledge on healthy communities, and they'll touch on several aspects such as housing, homelessness, equity, and transportation. First, we have Abby Bohannon, the co-founder of AMPG Consulting. Next, we have Kathy Elderman, the Vice President of Communications and Public Policy with the Colorado Coalition for the Homeless. Then we have Shauna Van Zee with the City of Fort Collins. And then we have Sylvia Tapman-Burris, also with the City of Fort Collins. Both of them are planners. And then we have Rob Presley with the Colorado Department of Local Affairs, and then Patrick with the Town of Erie. And with that, I'll turn it over to our first presenter, Abby.
Hey Hey all, happy Thursday. My name is Abby. As Braden mentioned, I'm one of the co-founders of AMBG Consulting, where we leverage community-based research and evaluation to build healthy, inclusive communities, and I'm thrilled to be speaking with you today. Next slide, please. So the current pandemic is exposing the grievous consequences of discriminatory laws and policies in this country. Through the COVID-19 outbreak, many health inequities have surfaced, especially with those with pre-existing conditions like heart disease, asthma, and diabetes. Although everyone is susceptible to getting COVID-19, people of color, low-income communities, people experiencing homelessness or housing instability, those who are incarcerated, and rural communities experience higher mortality rates, as well as higher rates of contracting the virus. This has implications for the planet as we influence how the built environment is shaped so that all Coloradans have a chance at living a healthy, connected life. Next slide, please. So the racial morbidity and mortality gap is illustrated in this gap created by the Colorado Department of Public Health and Environment. As you can see, Black Coloradans make up 7% of the coronavirus cases analyzed by the health department, despite the state's Black population standing at about 4% of Colorado's total. Hispanic and Latino residents make up about 22% of the state's population, but represent 28% of the coronavirus cases and 18% of the deaths examined by the agency. It's also important to note that many of these numbers are underrepresented, especially in areas that are under-resourced, don't have reliable testing services, or are in populations that may be reluctant to get tested due to gaps in access to healthcare or fear of discrimination. This reflects the national statistics as well. In Michigan, Black Americans comprise 14% of the state's population, but nearly 40% of coronavirus deaths. In Illinois, this infection rate among Black Americans is twice the percentage of the state population. And in Milwaukee, Black Americans make up 26% of the county, but nearly half of the infections and a maddening 81% of deaths as of Friday. Next slide, please. So why are Black and Hispanic and Latino folks more susceptible to complications caused by COVID-19, and how does this relate to planning professions? People who are Black and Latino face the kind of chronic health problems like diabetes, hypertension, and asthma, and lack of access to adequate health care that can transform COVID-19 from manageable to fatal. As seen in the data collected by the CDPHE Office of Health Equity, non-white Coloradans have significantly higher rates of conditions such as asthma and diabetes. These higher rates of illnesses are linked to the environment through current and historical data. Non-white Coloradans are also much more likely to live in a physical environment that exacerbates those conditions, such as those who are experiencing food insecurity. It's also important to note that race can intersect with other factors, such as income and criminal records, to exacerbate health conditions. It's possible that no group of Americans are more vulnerable to COVID-19 than the incarcerated and the homeless, and these populations have racial disparities as well. About 40% of people experiencing homelessness are Black, which is triple their share of the US population. Brown and Black people comprise 56% of the prison population, which is double the combined share of those races in the US population. Those living in confined areas, incarcerated people such as those who are incarcerated, people experiencing homelessness, puts people at a much higher risk of contracting COVID-19. Next slide, please. So why are there such race-based health disparities, and where did they come from? Well, generations of institutionalized barriers to preventative medical care, healthy food access, safe and stable housing, quality education, reliable transportation, and clean air have all played an integral part. Whether intentional or accidental, the planning profession has played a key role in shaping the way marginalized populations experience health and wellness today. Next slide, please. I'm assuming many of you are familiar with historical redlining. If you're not, you should Google it, redlining in your community. Many of the historically redlined communities were seen as undesirable areas, which were far away from employment or education centers or near environmental pollutants. As a result, people of color and low-income communities who lived in those areas were exposed to environmental conditions that led to health conditions created by lack of clean water, air, or safety. We see this today, decades after redlining ended. For example, Black or African American children in Colorado are twice as likely to have ever had asthma compared to white children, and the parts of Colorado that are the lowest income also have the highest adult asthma rates. Lower income is also connected to less quality healthcare. These patterns are especially prevalent in areas that have been historically redlined. It's also important to note that these neighborhoods are continually segregated through modern day policies that enforce these patterns, for example, the 2008 mortgage crisis. As you can see in the chart created by the Denver Department of Public Health and Environment, they map the death rate per 1,000 persons by Denver neighborhood from COVID-19, and a lot of these patterns overlay neighborhoods where there are high concentrations of people of color due to historical redlining. Next slide, please. So how does the built environment mitigate or exacerbate racial and economic health disparities in the time of COVID-19? Well, the current guidelines encourage us to stand 6 feet apart, wash our hands, and stay at home. Next slide, please. This presents a problem for people who are working low-wage jobs, those who are living in crowded housing conditions, and those with a high population density. This tool, the Colorado COVID-19 Social Distancing Index, weighs these 3 factors and demonstrates that inequitable social factors such as crowded housing and work situations can hamper the state's response to the COVID-19 pandemic and can also be a focus of planners in the future. For example, Morgan and Greeley are both rated high in the index and both have meat packing factories which have had nationally recognized outbreaks. Also, a high percentage of the people who are employed at these factories are people of color, lower income, living in overcrowded housing conditions and have no choice but to continue working to make ends meet. In Montbello, many families are living in multi-generational homes, which presents a problem. If one family member gets sick, the rest of the house is likely to get sick. Next slide, please. So as I said, income is another factor where there's a gap in healthcare access, as well as a built environment that may encourage unhealthy behaviors, such as high percentage of cars, prevalence of alcohol or tobacco retailers, advertisements for unhealthy options, etc. In rural parts of Colorado, where the income is lower, the built environment can exacerbate COVID-19 through limited resources like safe housing, electricity, healthcare, or internet access, which some use for telehealth and information access. In many of these communities, transportation is an issue as well, especially to seek healthcare or choose healthier options like the grocery store versus convenience stores. Next slide, please. In rural America, lack of clean water and overcrowding leave Native American populations, especially those living on tribal lands, open to a perfect storm of health and economic crises during the pandemic. Many of these communities are also under-resourced, rural, and don't have reliable access to hospitals, transportation access services, or economic vitality to weather the storm. Next slide, please. So clearly there are a lot of historical, cultural, and physical and economic factors that influence health outcomes, and all of these factors can intersect to create meaningful change. We as planners have influence over the place-based indicators, such as access to healthy food, safety, access to walkable neighborhoods, green spaces, safe routes to bike, connected transportation network that creates access to employment education opportunities, affordable housing options, clean air and water, and creating and maintaining places that build community. Next slide. So what can planners do to enact structural change and ensure that all communities have an equitable chance at healthy living? First of all, prioritize investment in marginalized communities to counter previous disinvestment through an equity lens. Partner with communities to build capacity for change, and this includes knowledge that communities that face, knowing that communities that face challenges also have the knowledge and power to develop creative solutions to the root causes of inequity. So for example, in 5 Points and Elyria Swansea neighborhoods in Denver, both of these neighborhoods have a history of redlining, housing segregation, and disruptive development. A local community organization connected with residents and promoted community-led efforts that were able to strengthen the community. Residents were able to build capacity in the communities and work towards strengthening their community networks to uplift community supports and boost their overall health. And lastly, planners can understand the intersecting factors and potential ripple effects of the decisions made in the built environment and how to counteract them. Next slide. So thank you. If you have any questions, feel free to drop them in the chat box or send me an email following this presentation, and I'm happy to discuss more. Next, I will turn it over to Kathy.
Hi, good morning, everybody. My name is Kathy Alderman. I'm the Vice President of Communications and Public Policy for the Colorado Coalition for the Homeless. We are a statewide organization, and we are a housing and healthcare provider. So we don't provide traditional shelter space, but we work very closely with our shelter partners across the state to address homelessness and to come to and identify lasting solutions to homelessness. Next slide, please. So some of the issues regarding managing homelessness in this public health crisis is that essentially being homeless is incompatible with our current public health guidelines. Our messages from our elected officials and our public health professionals are telling us to do simple things that people who are experiencing homelessness can't do. For instance, unhoused people can't stay home. They can't isolate in their home. They don't have access to sanitation facilities, so they can't engage in the regular hand washing that is recommended by our public health guidelines. And social and physical distancing is virtually impossible when you're living in a sheltered environment. Some of the challenges that we're seeing with how our current systems to address homelessness are that shelters are meant for emergency situations. And unfortunately, we have come to let them be the solution and the housing solution for people experiencing homelessness, rather than continuing just to rely on them for emergency situations. Congregate settings are bad in public health crises. We know this because we're not allowed to gather with more than 10 people, and many of our shelters will have more than 500 and 600 people on any given night. And the emergency response funding tied to public health guidelines doesn't necessarily take homelessness into account. So for instance, right now, FEMA is providing funding assistance for non-congregate settings. And while that is an ideal response to this public health crisis, you can't achieve non-congregate settings in congregate settings. And so we need a system, funding system that is more responsive to all the needs of people experiencing homelessness. Next slide, please. So some of the strategies that we're working on to address the crisis of homelessness within this public health crisis is that we need to undertake de-densification efforts in our current shelter situation. So for those of you who are in Denver or following the news on this, you'll know that the current shelters were attempted to consolidate into the National Western Center. And that was in an effort to leverage resources and staff, as well as to provide some social distancing where social distancing wasn't previously possible, by allowing more space for individuals in these large congregate settings. Through that process, we were also able to begin screening and testing everybody that came into that facility. So anyone who demonstrated symptoms, had known exposure and high risk factors, we could screen and then triage for testing. If they tested, if they were able to be tested, then we can move them into isolation units, and those are largely in motel and hotel spaces. Those spaces are really used for two purposes. One is activated respite. That's for someone who's been tested and is awaiting testing results and needs to isolate but doesn't have a home to isolate in. The second is for people that have tested positive and need a space to recover because they can't go home and recover, and the hospital is obviously not the best place to recover unless indicated. The second type of motel hotel space that we're working on acquiring is for protective action. This is for individuals that are very high risk for health complications if they were to contract the virus. This is for those that are 65 or older, currently have respiratory illnesses, or immunocompromised systems. That's a large population of people experiencing homelessness. In fact, somebody who's 45 years old and has been homeless for 6 to 10 years will present medically as a 65-year-old. And so we're working as quickly as possible to move people from these congregate settings into motels and hotels in order to protect them from contracting the virus. Because we know that if they do contract the virus, they're 2 to 3 times more likely to need hospitalization or critical care, and 2 to 3 times more likely to suffer death from the virus. 1 in 3 people in Boston shelters have shown to be carrying COVID-19 but are asymptomatic, meaning that people living in these congregate settings are much more at risk for both spreading and contracting this virus. And that's why these de-densification efforts and these motel hotel strategies are critical. But we can't forget that we need long-term housing options. We need resources to make sure that those housing options can work for people, including both the housing stock and vouchers and services to keep people stably housed. Next slide, please. We've been engaged in quite a bit of advocacy efforts in order to make sure people really understand the unique crisis of homelessness within this crisis. So we've done a great deal of media outreach and public education outreach. So hopefully people are seeing some of that. We've written a number of letters to the governor from our colleagues, our community, and providers, and we've been engaged in a bit of federal outreach. And what we're asking for is help acquiring motels and hotels for people to isolate and recover in. Help with de-densification and shelters by providing staff and space. We need more testing for guests and staff because again, that asymptomatic transmission is very troubling in these congregate settings. We need more personal protective equipment for guests and staff. People don't always have access to the cloth masks that are being made at home. And obviously we need more funding both at the state, local, and federal level. Next slide, please. So what has this crisis exposed in terms of some of the gaps that I think planners can think about? First and foremost, we don't have enough affordable and accessible housing. We've kind of failed to really make that obvious link between housing and health. So again, if you don't have a home to isolate in during a public health crisis, your health is going to be compromised because of your housing status. We need more supportive services. So it's not enough just to put somebody in a space and tell them to make do or good luck. We need to provide those wraparound services to make sure that they have access to the supplies, equipment, and essential items that they need in order to stay stably housed. We need to recognize that shelter is not meant to be a long-term solution. It never was, and the fact that we've allowed it to be has really exacerbated this crisis. We need stronger connections between our public health professionals and our homeless service providers. Our homelessness service providers are obviously engaged in social work and in case management, but they're not healthcare professionals. And during a public health crisis, that can be very difficult to be told as a non-clinical person that you need to engage in clinical screenings. So we need stronger health connections between our public health entities and homelessness service providers. We also really need to understand how our current homelessness response system works, because I think there's a lot of people that just don't understand that social distancing, physical distancing cannot be achieved in these overcrowded spaces. And so how can we better educate our public about how these systems work? And then we really need to understand that homelessness service providers and shelter providers are frontline first responders. Just like people in hospitals, they are seeing thousands of people every day with chronic health conditions, with severe mental health issues, and that are going to be immunocompromised. And so we can't ignore them when we talk about our first frontline staff and first responders. Next slide, please. So the things that I think are interesting for planners and everyone else to be thinking about is how can we build systems that can be more sustainable and not just about crisis response. In the homelessness service provider world, we are always responding to crises because people are always in crises when they are unstably housed or don't have a home. And so how can we look beyond this crisis to make sure we're putting systems in place that can be responsive to homelessness long term? We need to think about what the implications of relaxing the stay-at-home order might be. We've housed over 380 people in motels and hotels, and we've told them to treat those spaces as their homes. If that's relaxed, what does that mean for them? And how do we think more comprehensively about relaxing standards that don't necessarily apply universally to the full population? We need to think about what testing, treatment, and vaccine prioritizations are going to be, because people that have remained in congregate settings during this crisis are more likely to have been exposed to the virus, are more likely to suffer complications because of the virus, and should be prioritized for any testing, treatment, and vaccines that come online. We need to think about the fact that we have relied on the nonprofit and faith-based groups to solve homelessness for so long that sometimes our cities, states, and federal government don't even know how to address the issue. And so how can we come up with some comprehensive solutions that involve all levels of government, including the nonprofit community, to build out this infrastructure? Obviously, we need more housing resources, and we need to think about the housing resources that we have available. We haven't had a lot of conversations about the fact that we have thousands and thousands of market and luxury rate apartments sitting empty right now while people are forced to sleep outside. And how can we leverage those resources to make sure that everybody has a safe home? We also know that it takes a lot of time to get critical housing resources online and available. And so what can we do in the interim to provide bridge and transitional housing options? And as I mentioned before, we really need to consider the supportive wraparound services that result in housing stability long term. And finally, I will always make a plug that we need a better understanding and we need better community planning efforts that really honor the link between housing and health. Because again, your health status is so dependent on your housing status, and your housing status can really impact your health status. And so as we think forward and about building smarter, better communities, we need to honor that link. And that's it. I will turn it over to Sylvia, I believe. Shauna, Sylvia, thank you.
Good morning, everyone. My name is Shauna Van Zee, and I'm an associate planner with the City of Fort Collins.
Hi there. I am Sylvia Tapman-Burris, and I am a city planner with City of Fort Collins on the long range planning team.
And next slide, please. So we wanted to share with you some of the work that the City of Fort Collins is doing right now and that we're a part of. We've both been working on a grant-funded project, which we call Home to Health. So this is a project funded by the Colorado Department of Public Health and Environment's Health Disparities Grant. It's a 2-year project and it's very collaborative, and that's really at the center of the work that we're doing. So our objective over the next 2 years is to implement updates to policies, codes, and regulations to improve housing affordability with a specific emphasis on health equity. So something we really want to emphasize is that this is not something we're doing in a silo. We've worked really hard to incorporate community partners at the core of the work that we're doing. So we have 5 community partners that we're working with. It's the Family Leadership Training Institute at CSU Extension, the Center for Public Deliberation, La Familia, Larimer County Department of Public Health and Environment, and the Partnership for Age-Friendly Communities. So we really have a diverse team that we consider our core team within this project, and they help navigate what is appropriate for us in terms of conversations, who should we be incorporating, and how do we really create good health for all. So Sylvia and I are both working on this project. My emphasis is on the community engagement side of things, and Sylvia is focusing on housing policies. So next slide, please.
All right, thank you, Shauna. As Shauna mentioned, I am also working on the Home to Health project. My focus is really on how do we work with affordable housing policy. We're updating the Affordable Housing Strategic Plan with our Social Sustainability Department. And what we've received a lot of direction from our city council. So I think for those of you who work in city government, we really take the guidance from our city council as to what they would like to see in terms of affordable housing policy. And we're in an interesting space to begin with, that we have council members who are very, very focused on affordable housing. And we've become even more laser focused on this as a subject because of the COVID-19 pandemic. So I think it's a really interesting time for us to update our affordable housing strategic plan, and we're moving more towards a plan that looks at the full spectrum of housing needs, which means we are going to be incorporating the income bracket from 80% area median income up to 120% area median income, which we hadn't done before. And what that really means is looking at different funding streams. So looking at funding streams below 80% AMI, those are usually your low-income housing tax credits and other sources of government funding that are often federally based or state-based. And so now we're looking at some different strategies from state taxes, sales tax revenue, impact fees, inclusionary housing policies. We actually just recently did a inclusionary housing ordinance and impact fee study and found that right now with market conditions and probably moving forward, that those won't be favorable for the next couple of years. So really trying to look at what other policies can we institute and what's the political feasibility of those, especially since anything we do from taking out bond financing for maybe down payment assistance that's deeper to really get at the needs of our community for those sort of mid-level income brackets. And then we've really looked at how do we change our land use code to reflect some of these policies. And we're in a time where we're not going to be signing a lot of contracts for consulting services that we would otherwise do to do a lot of the analysis for how do we move forward with these policies. And so we're looking at how can staff take this on. So I think creating a lot of scenarios, modeling how some of these funding sources can be utilized has been really helpful to us. And we would be doing that no matter what. But I think, it really is more of a laser focus and we realize that we haven't been meeting our affordable housing goals for the last several years, and that we're really going to need to be finding more creative solutions to meet those goals for our affordable housing strategic plan. So I think that's where we're at right now, is really moving forward with those creative solutions that can be rolled out more quickly than we have in the past. So let's go ahead with the next slide.
So we thought it could be helpful to share a few questions that we're asking ourselves in this time of transition that you could possibly take back to your groups that could be useful. So one thing that we're asking ourselves is, why do our community partnerships matter? So like I mentioned before, our community partners are really at the core of this grant effort. And one thing that we have seen is that they are connected to a community in a way that we are not able to be connected to the community. They have already built that trust. And so we want to honor that trust by bringing them into the conversation and making sure that those voices that are historically underrepresented can be incorporated into these housing policies that we hope to make. And so how does that affect the future of planning? I think that we're going to move more and more towards partnership with those outside agencies, which can make a project more difficult because the more voices you bring to the table, the better the outcome, but it also can create more time. But ultimately, we feel that that creates a more equitable outcome. And it also creates what I would consider equitable accountability. So they're making sure that with each event, each outcome, each outreach effort that we're doing, that the people that they represent can have a voice at that table. And so one of the ways that we've been doing that within the Home to Health Grant project is through storytelling. So as you know, many of the traditional ways that we as planners allow people to participate is through things like town halls or coming to a city council meeting and sharing their views, but that's not a perfectly equitable system. And any in-person meeting is not necessarily a perfectly equitable system. So we're thinking about, how can we bring stories of those who typically would not participate in our processes to the table? And as we know, housing and health policy can be very complicated and feel incredibly impersonal. So how do we bridge that gap? How do we take the stories of our community members who are experiencing housing instability, health instability? How do we create a way for them to share their story that could impact the final outcomes of these health and housing policies? And I also want to build off of what Kathy said, with building systems that are more sustainable than just crisis response. I think you want to be prepared in a way with partnerships that already exist, so that when crisis comes, you already have that relationship with the people who are on the front lines. And so part of our effort with this is to continue to incorporate more voices, more community partnerships that are really on the front lines, who are gathering the data we need to highlight inequity, so that we can address that more appropriately in the future. Sylvia?
Yeah, great. Thank you, Shauna. I think another thing we're looking at is, how do we evaluate the assumptions when it comes to housing policy? I think Fort Collins is in an interesting space right now already, where we've been sort of moving from being a mid-sized community to functioning more as a city with a larger population, really starting to build out some of the areas where development can occur. And so assumptions going forward, are we going to have issues with low-income housing tax credits? Are those going to become less available into the future because people have less tax liability because of their business situation or their income situation? And then we're going to really need to look at those other sources of funding that rely more on our local populations. And so how do we work on that in a political context, where we know that housing affordability is a top priority for our population, but how do we really help people understand that it will help the community overall if we can tackle the affordable housing problem that we have in our community? And then I think just emphasizing again, how can partnerships to be leveraged to tackle these issues? So how do we build those partnerships for funding? How do we utilize more of our housing groups towards advocacy of certain projects that we haven't had in the past, and certain policies? and how do we help them to leverage and educate their populations for how these policies will affect their members and participants into the future. And so I think those partnerships are important as the city rolls out policies. The city staff is not going to be necessarily direct advocates of these policies. They're saying, here's what you're looking for, here are the things that we can provide to you, and how these policies we assume to affect the populations into the future, and then we would rely on our community and our community members to really advocate for what they feel is what the community needs right now. So I think those are some of the most important questions we're pondering. We don't know how COVID-19 is going to affect us. We're still really at the start of the economic fallout from this. And so I think just really continuing to ask those questions, really question our assumptions going forward, and really looking at those creative solutions will be important for us moving forward. So next slide, please. Great. So I think we're really interested, for the folks that are on the call today, to really continue the conversation. We've reached out to several of our local municipalities to ask how are they doing virtual planning and zoning board hearings. How did they change their municipal code to allow for those things? And we've actually moved forward on that with our city council. And so we would love to be a resource or just a partner for other cities of similar size to tackle some of these issues together. So please feel free to reach out to us. We would love to hear from you. If you have questions about what we've talked about today, please visit us. And Shauna, do you want to just talk about the Our City page real quick?
Yeah, we've provided a link to the work we've been doing with Home to Health. And I just want to reemphasize again that just like the other speakers have touched on, the future is really more interconnectedness between our health and our housing policies, and educating our decision makers in the community about how that's even possible. So thanks so much. I think that concludes our presentation.
Great. And we'll turn it over to Rob. Thank you so much, everyone.
All right. Good morning, everybody. My name is Rob Presley. I am the Resiliency Program Manager in the Colorado Resiliency Office. Next slide, please. And just real fast, for those who may not be familiar with our office, we are housed within the Department of Local Affairs. We, among other things, provide state and local technical assistance to implement resiliency planning and also support long-term recovery efforts around disasters. So, we anticipate working closely with communities across the state through the COVID-19 crisis and into the recovery phase of it as well. Next slide, please. And, now is a really interesting time to be thinking about resiliency, especially as it relates to healthy communities. We're all in a situation where we've never really thought we'd find ourselves before, and we have an interesting opportunity to think about how we can look towards the future to improve our communities and provide for equitable health across all populations. Here, when I'm talking about resiliency, this is actually what you see on the screen is the state's definition of resiliency in statute. The thing that I really want to focus on for the conversation today is what I've bolded, and it's rebounding and positively adapting to or thriving amidst changing conditions or challenges. That's really kind of what's at the crux of resiliency and what we focus on when we're talking about it. Next slide, please. And, in this current crisis, communities have really recognized the need to provide an adaptive response, and recognizing the need that people need to stay active during the current stay-at-home orders that we have. Keeping people active helps them stay healthy, not just physically, but mentally as well, allowing them to take a break from being cooped up inside, move around, interact with nature, and just de-stress. And resiliency is, like I mentioned, really all about being adaptable and flexible to changing conditions and events. We've seen a number of examples of communities in Colorado and across the country demonstrating their resilience, being nimble and making quick changes that help them respond to the COVID crisis within their community. For example, emergency measures have been taken, which include closing streets, suspending fares for public transit, making bike share free, adding in temporary bike lanes, and automating street crossings so that pedestrians don't have to actually physically touch a signal to get the crossing sign for them. Here in Denver, where I live, for example, the city has shut down a number of streets to cars, they've closed the roads to really encourage people to get outdoors and simultaneously feel safe while walking and biking, while being able to maintain that proper social and physical distancing. Next slide, please. And, you know, a number of these changes, if not most of them, are temporary in nature. But, you know, it's a really sort of interesting experiment that we're finding ourselves in, where we're exploring the different ways that, you know, we can use and interact with our streets, and really for people to experience it firsthand, rather than sort of being an abstract thought. You know, with better access for biking and walking, people and cities can now see what it means for streets to be people-oriented rather than car-oriented. And we have the opportunity to ask ourselves, you know, are our streets functioning better with some of these emergency strategies that we've been implementing, and really ask if we want them to continue that way when we're ultimately done dealing with the COVID-19 crisis. You know, building streets for people can have drastic impacts on community health, from getting people to be more active from biking and walking, providing more equitable access to places like jobs, grocery stores, doctors' offices, you know, for those with limited or no access to cars, reducing injuries and deaths from car crashes, improving air quality from reduced vehicle emissions, and ultimately enabling greater community connectivity. And all of these things contribute to healthier and more equitable communities. And so this is a sort of one way that communities can think about how their planning efforts can change to improve community health. Next slide, please. So the chart that you see here is already one that you've seen. Abby discussed a lot of this, so I'm not going to go too in depth on any of the details on it. But really just wanted to highlight that, again, COVID-19 pandemic has highlighted existing inequalities in our communities. And really, I just want to say, you know, it's not a coincidence that the communities like the African American and the Latinx communities that are seeing disproportionate impacts are the ones that have also faced decades of institutionalized barriers, like access to preventive medical care, healthy food, safe and stable housing, reliable transportation, clean air, and quality education. And again, those that are the most vulnerable are often the ones that are performing essential jobs, like working in grocery stores or hospitals, manufacturing, construction, and they may not have the luxury of working from home, taking sick leave, or access to adequate health care. And so planners and communities, they really need to bridge the gaps that these communities are facing through policy change if we're to really see an equitable approach to building healthy communities in the wake of COVID-19. Long-term stressors like these really make us as a state less resilient to future disruptions. And if we're not addressing the health needs of our most underserved, we're not really going to fully recover from this current event or future ones as well. Next slide, please. And so, you know, resiliency is really all about that long-term thinking and building in policies, plans, and programs that make governments, businesses, and communities more adaptable to future threats, whether they're pandemics or natural disasters or economic downturns. You know, a resilient recovery is not just bouncing back to where you were prior to a shock event, but about bouncing forward and being better off than where you were to start. So now really is the opportunity for planners and communities to look at how our policies around street design and transit, housing, and food access can all take into account future threats, so that, you know, for the next major issue that we're going to face, we're better off prepared. You know, change is going to take time, but we've seen rapid responses from communities that have had positive impacts, so we know it can be done. And at the very least, like Dan Rather says here, maybe you know, we can at least widen our sidewalks when this is all over. So that's it for me. I realized I failed to provide a slide with my email address, so I'm happy to take questions in the chat, but also you can email me at any time at rob.presley@state.co.us. And with that, I will turn things over to Patrick.
Hey everybody, my name is Patrick Hammer. I'm the Parks and Rec Director with the Town of Erie, and I'd like to first just thank you for including Parks and Rec in the conversation. Like all of you, we're trying to kind of innovate our way through it. So next slide, please. Today I was my plan is to kind of talk about maybe a little bit more of an operational perspective, as you guys have heard. You know, obviously the COVID-19's got significant impacts on people and well-being, right? Being sheltered in place can be stressful. And what we found almost immediately is that people wanted to flood into our outdoor spaces. And we feel pretty strongly about that in Parks and Recreation, that we want to be that outlet for people, but we also have to do that in a safe way. And I will say that I think some of park planning has been great in accommodating that. And then I think for parks that have been over amenitized, that probably hasn't worked all that well. But as you can see, you know, the challenge really became in Parks and Recreation is there enough room for everybody to be out and enjoy the amenities safely? Also with the understanding that people enjoy amenities completely different. Everybody on this forum today values a trail, a park, a playground, an open space completely different. And as we start to see thousands of people kind of flood into our park system, we realized that maybe we weren't as prepared as we should have been. And I included just a couple of examples that actually segue really well with Rob's presentation of that top picture over on the right is day one of the stay in place order. We had over 70 cars parked at our mountain bike park, which is way more than we would normally experience on a normal day, even our busiest weekends. As Rob mentioned earlier, Denver started to shut down public streets to make sure that people could safely get their way to parks. And then that created an unintended consequence of being in this position where we were trying to keep people somewhat distanced from each other, but they all wanted to congregate through centralized access points at trailheads, parks, dog parks, in our case up in Erie Bike Park. So it was a little bit of us feeling like we had a way to relieve some of the stress, but we also knew in Parks and Recreation that we could potentially be a cause of people getting sick. And that became an interesting challenge for all of us to work through on the onset. So next slide, please. And I'll be sensitive of time, making sure that we leave opportunities for questions. But from Erie's perspective, in addition to making some really quick operational changes, and I know that was mentioned earlier in some of the questions, you know, we're considering adding an additional 6 to 8 foot mow band on the side of our trails. We got lots of complaints right away about people not being able to use trail corridors and feel safe from each other. We were looking at cutting in secondary entrances and third entrances to dog parks, widening trailhead corridors as kind of temporary solutions. But when we were working with our elected officials on potential budget cuts, I had 2 projects in particular. One is a $5 million park master plan project that we actually pushed hard with the elected officials to keep and to prioritize, specific to the fact that we had planned into the overall site plan a lot of open areas where people can experience Parks and Recreation in a little bit more of a passive sense. It wasn't going to be over programmatic. We weren't going to line it with tons of great play equipment. We actually wanted to provide a little bit more peaceful area. And I know the image is not great, but the image on the left, we've got reading areas now, reading nooks built into the plans. We had dedicated hammock areas where people can come up and use hammock posts. We're actually looking at modifying the bike park on the north end of that image to create a little bit more of a passive space. And we were able to use this example as a way to say, we actually really value this project. We know we need to consider budget cuts right now, but this project in particular could actually improve well-being, as well as allow people a little bit more space to navigate around each other and still experience the benefits of being outside. On the right-hand side, Erie Disc Golf Course, this is an open space corridor, and ironically, this was one of the first projects that was discussed to be cut. And we said, wait a second, let's look at the current conditions that we're in. For $75,000, we can build an 18-hole disc golf course in a unused piece of open space and provide an opportunity for people to get outside, recreate safely, and enjoy a little bit of quality of life while maintaining what may be this new norm of social distancing. And I mentioned earlier, you know, we're innovating as we go. We're redesigning irrigation schedules. We're finding that there are more people using our parks in the middle of the night. Maybe they're shift workers, maybe they're people who are stressed out and not able to sleep, people who are walking their dogs. We turned on our irrigation systems in the town of Erie and immediately said, hey, we're getting people soaked in the middle of the night. we're relaxing some of our standards or our thoughts on social trails that develop. Typically, we don't like social trails developing, but we understand that joggers now may want to be 6-7 foot off of a concrete trail running in our grass open space areas. And instead of aggressively pursuing measures to stop that, it probably makes sense that we're a little bit more accommodating to that. And we've also started to look at our signage packaging. With knowing that so many people are out and about in our communities right now, I personally feel that positive signage that can be placed along trail corridors, and I think most jurisdictions are doing that, is a completely appropriate way to encourage people to be outside, but remind people to be safe. There are some places specific to Erie where we are completely inundated with people, and we know that that's inconsistent with what the current stay-in-place regulations are suggesting. So we're changing operations for farmers markets, for community gatherings. We're looking at ways to space people out to make sure that people can enjoy what they once knew and still feel safe, right? I think we're all trying to gauge what people's reactions are going to be and how in Parks and Recreation we can best accommodate that. And these are just a couple of quick examples of us trying to kind of innovate on the fly and push projects to the forefront to make sure that we're being responsive in real time to a situation that I think could last for a while in Parks and Rec. And with that, I know we've only got about 10 minutes, so maybe we move on to questions.
Yes, thank you to our presenters again. So we don't have too much time left. So we'll go through a few questions, but just know that your comments will be addressed and we'll share those out with everybody so that everybody can have them and see them. So our first question will be for Abby. So how are you adopting a health equity lens into your work, particularly when you come from places of privilege and may lack cultural competence? So we'll start with you, Abby, and then if others want to jump in, that's fine too.
Okay. So at AMBG Consulting, we think about this quite a lot, especially when working with a variety of communities. One thing that we do is we use a language justice model. So we make sure that all of our materials are available in English and Spanish. We also try and meet people where they're at. So and try and approach each conversation with a sense of humility and try and recognizing that the communities that we work in are really the experts at understanding what they need. We also in the reports that we generate and with community partners, we try and highlight the voices of people who maybe have been left out of the conversation to make sure that those voices are impactful and help drive decisions moving forward.
Thanks, Abby. And moving on to our next question, we'll address it to Rob. And again, this is also open for others if they want to chime in or jump in. Have you learned any lessons that will carry over into operations during normal times? So you talked about, for example, open streets. That could be a way, Denver's doing that now, but what about during normal times? Will that last?
Sure. It's a good question. I don't know whether it's going to last. Again, I think these measures were taken just sort of as temporary or emergency measures. But the longer that they stay open as we go through this, I think you might see more of a appetite or eventually a demand for better access for bike and ped activities. So I don't have a good answer necessarily at the moment. We'll just have to see how it all plays out. But I'm sure there will be some folks who are going to be asking for potentially more streets to be opened, whether it's full time or something like on Sundays these streets are closed to cars.
From a Parks and Recreation perspective, I do think that as we used to know how people gathered, at least for the next year or so, will fundamentally change. So from a programmatic standpoint or from a design standpoint in terms of Parks and Recreation, I do think that there will be some lasting changes. Operationally, we have already had to implement several changes to basically accommodate increased sanitation efforts and then 6-foot social distancing. I think you could probably argue that the joy and the value of a large community event is changed significantly. If everybody's got to be spaced away from each other, some of that kind of human closeness that's really a benefit has changed. So I think operationally, those are the items that we're all considering in Parks and Recreation that'll probably last for a while.
Great, thank you. And then this one is for Kathy. What will happen when things open back up and the homeless people staying at hotels, etc., have to leave? Do you think there will be issues both psychologically and or physically with taking people out of these secure places where they have been able to eat, sleep, bathe? And 2, there are concerns of a second wave once the state is open back up. Will places reopen their doors to the homeless if COVID makes a second attack?
Hi, that's a great question. I really appreciate the thoughtfulness of it, because that is what we are talking about right now. So we are starting the planning process right now of making sure that as we discharge people from these motel spaces, that we're not just discharging them back out to the streets and to the shelters, but that we are starting to put long-term housing plans in place for them. But that means that we need additional resources like vouchers, and we need more landlords and housing stock to be available to us. I think one thing that is interesting about these hotel and motel stays is that this does provide people with a sense of stability, whereas it might be difficult to house somebody coming directly off the streets or directly out of shelter. While they've been in these motels and hotels, they've gotten a better sense of what it's like to have a home and to have space. And that does provide a better bridge to housing and housing success than coming directly from shelters and streets. Many of these motels and hotels we do have master leases for and contracts for 6 weeks and even up to 2 to 3 months, recognizing that this crisis will be borne by this subset of the population for a much longer period of time than it might for our housed community. And so we were hoping that that time will give us some space to really make this housing plan, put this housing plan into place for as many people as possible. In terms of when we see our second, third, hopefully not, but fourth wave of cases, it's going to be critical that we maintain these relationships and that our elected officials are smart about how we open up tourism and travel. Because I think, to your point, that if we start allowing a great deal of travel, we're going to have less participation among motels. And right now, the state hasn't provided any incentives or any real reasons for these motels and hotels to participate. And so that's going to be critical that both our local and state government provide ways for these hotels and motels to stay engaged, get access to resources for their participation, and help us with the long-term solution by serving maybe as this bridge and transitional housing option for people on their path to housing stability.
Thanks, Kathy. And with that, just a reminder, we'll send out all the responses to the chat questions remaining. And with that, I'll pass it on to Sheila.
Thank you, everyone. That was a great panel discussion, and thank you, everyone, for attending. As noted, we will be placing this recorded town hall on our website, so look for an email today or check back later this afternoon, and we will have it posted. Our next town hall is next Thursday, April 30th at 9 o'clock again. We're going to be looking at the effects of COVID-19 on our transit providers, so we hope to see you then. Thank you again for coming, and thank you, panelists, for all the effort you put into this.